Hi, I'm John. I'm a nurse practitioner and I own my own telemedicine, functional medicine practice. I was recently asked why I practice functional medicine, and I wanted to share my answer with you. When I was age 23, I had a knee injury for which a physician, my PCP at the time, prescribed a nonsteroidal anti inflammatory for me. After 3 weeks of taking that medication, I began having a lot of abdominal distension and really bad constipation. And those symptoms just continued to get worse even after those 3 weeks and after stopping the medication. I Within 2 3 months, I started having additional symptoms that included brain fog, difficulty concentrating, fatigue, rashes that would last for months and months and months on end. And those symptoms just got worse. Every time that I ate, my symptoms exacerbated, and there were often many times where I just felt toxic in my body. Over the course of 20 years I had these symptoms, I saw multiple physicians, some my PCP and some gastroenterologists who specialize in GI stuff. And unfortunately, all the tests that they did, scans and colonoscopy, etc., that all came back normal. So they weren't able to explain why I was having these symptoms. Um, at about the 2022 year mark, I was diagnosed with some complications of fatty liver and prediabetes, at which time I came across functional medicine and I started studying it very intensely. So, to help myself, because there was just been just no answers. I learned from studying functional medicine that the prediabetes and fatty liver came from having all that gut inflammation for so many years and not having any relief. So fortunately, I was able to resolve all of those symptoms that I was telling you: the fatigue, the abdominal distension, the constipation, all that stuff went away. I reversed my fatty liver with functional medicine and stabilized the prediabetes. I still have to work in order to maintain that health because it can go backwards if I let it. But I was very successful in helping myself, and I'm very happy that I found functional medicine. And that's why I practice functional medicine, because I know that there are people out there, such as myself, who have these obscure symptoms that just can't be explained. And I want to be able to help those individuals and help anybody who has chronic conditions that they want to stabilize or they're having a hard time getting control of. And so it's just my passion to help individuals, and I hope that comes across. So, my journey over those last 20 plus years taught me a few things that I bring to my practice. One is traditional medicine and functional medicine each have their place and they have their limits. And I very much believe that working with them concurrently can give you the best outcomes. Second, I understand that everybody's individual and that what works for one person will not necessarily work for another person. And so there has to be that knowledge and flexibility to provide that individuality to the care plans that your treatment plans that I prescribe. And lastly, you really need to be comfortable with your provider, have a knowledgeable provider, and one who is willing to sit down and listen to you and wants to do the right thing for you. I'm able to see patients in Texas and Colorado. So if you're interested in seeing me, check out my website, and the link is in the bio. I'd like to know if anybody has had similar experiences with the healthcare or having those symptoms. Feel free to leave a comment, like the video, and DM me. Hope you have a good day.